Chapters 14 to 23. Complete the table with words from the opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Noun, exhaustion, adjective, exhausted, fatigue, fatigue, lethargy, lethargy, tiredness, tired. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sorts, present with, put on, worn out. Complete the sentences with the correct form of the verb present. Number one, a 67-year-old man presented with a 9-month history of increasing shortness of breath. Number two, the most common presentation is loss of consciousness. Number three, cranial arthritis may present as fever without any obvious causes. Number four, the patient usually presented with a severe sore throat. Number five, the presenting symptoms in this patient could perhaps be due to renal failure. Number six, other conditions with a similar presentation include acute cholecystitis. Number seven, reduced growth is an important presenting complaint of celiac disease. Number eight, 2 months following presentation, the patient was able to walk. Read the patient's description of her symptoms, then complete the case report. Look at the opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired. But lately, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. Case 13. A 50-year a 50-year-old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight in this year before she presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair has started to fall out. Find words in the box with opposite meanings. Look at B and C opposite to help you. Inadequate, adequate, against, for, likely, unlikely, severe, mild, severe, mild, rare, common, sudden, insidious, sudden, insidious, inadequate, adequate, against, for, likely, unlikely. Make word combinations using a word from each class. Look at B and C opposite to help you. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing, vibration zone. Complete the sentences. Look at A, B, and C opposite to help you. Number one, a 39-year-old man presented with a history of progressive abdominal distension over period of 6 months. Number 2, blindness may be caused by vitamin A deficiency. Number 3, the bleeding and purpura are caused by abnormal platelet function. Number 4, the white cell count is normal, so we can exclude acute leukemia. Number 5, the yellow color of her skin and conjunctiva is probably due to jaundice. Number 6, there was a palpable mass in the right upper quadrant of the abdomen. Number 7, treatment is aimed at restoring fluid balance with adequate intravenous fluids. Number 8, the anemia may be due to increased red cell breakdown. Complete the conversation. Look at the opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so I didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have symmetrical paresthesia or absent vibration sense. And I couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. Label the diagram using words from the box. Look at A opposite to help you. Number 1, skull. 2, jawbone. 3, spine. 4, breastbone. 5, rib. 6, collarbone. 7, shoulder blade. 8, thigh bone. 9, kneecap. 10, chin bone. Match the types of fracture 1 to 5 with the descriptions A to E. Look at the opposite to help you. A, there is a break in the skin. Number 1, open. B, the bone is bent. It occurs mainly in children. Green stick. Number 4, C, the bone is broken into several pieces. Comminuted. Number 2, D, the broken pieces are separated, displaced. Number 3, E, the broken pieces are pushed together, impacted. Complete the textbook extract. Look at the opposite to help you. Reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will be united, but it may go on to malunion.